Hi viewers, welcome back. In today's video we are going to discuss about low birth weight baby. Okay, so what is the meaning for low birth weight baby? Low birth weight babies are babies who are having a weight less than 2.5 kg or 2500 grams at the time of delivery. Okay, so these type of babies, either they can be a premature baby, a preterm baby, or a small for gestation baby. So anything can be present. Okay, so now we will see the causative, that is the causative factors which causes low birth weight babies. Okay, so first is the maternal factors and the social factors. So maternal factors, we have when the mother is not having a proper gestation area. Okay, so that is like a mother who is having a short stature, a mother who is like with the very low age group, a mother who is above the age of 35, and unmarried mothers, like illegal pregnancies. In all these areas there will be a small low birth weight babies. Okay, and then when we come to the infection part, when the mother is having some infections of rubella, influenza, syphilis and all these type of infections, so at the time of pregnancy there may be a low birth weight baby. And then diseases or your chronic diseases as your diseases of the cardiac system like heart, lung, liver, kidney, in all these vital areas, and your chronic illness of your diabetes and hypertension, all these areas also can promote low birth weight babies. And then nutrition part, when the mother is belonging to a low socio-economic group, when the mother is anemic, so in that area. And then trauma, when the mother is having some physical illness or your psychological illness, something, any trauma, physical or psychological trauma, so that can affect the baby. And then drugs, when the mother is having consuming alcohol, smoking, or otherwise when she is taking illegal drugs, all these can cause inadequate placental perfusion that can hamper the weight of the baby. Okay, so that is with the maternal factors. And then comes the obstetrical factors, that is like when the mother's obstetrical history is not sufficient obstetrical history, when the adequate supply of hormones is not present, when the mother is having some uterine abnormalities, so already she is having an history of small for gestation, all these areas can have a history of low birth weight. And then we have uterine factors you have to remember that the mother is having some uterine abnormalities, that is like some congenital anomalies of the uterus, as your bicornate uterus, or like any abnormalities like uterine factors, congenital anomalies of the uterus, when the mother is having frequent pelvic inflammatory diseases, and all those things can promote small for gestation baby. Okay, then we have placental factors, when the placenta is very small, which is not adequately providing nutrition for the baby, when there is a congenital anomaly of the baby at that time, and when the placenta is infarcted, that is like when there is an inadequate placental perfusion, so there may be infarcts. So placental infarcts, that you will be ruling out only after the delivery when you do a placental examination. And sometimes when there is multiple pregnancy, the placenta will be a single placenta where it is distributing the nutrition, so at that time, so anything, so any problem that is with your placenta. And the environmental factors, you have to remember the environment where the mother is living and the mother is working. So where the mother is living, the home environment, how many family members are there, whether she is able to take adequate nutritional food, all those things matter. When you are coming to the working environment of the mother, you have to assess where the mother is working, and whether she is working in an hazardous area, how is the workload of the mother, whether she is taking adequate rest, all these things you have to assess. Then we come to the fetal factors, where we are like little worried when there is a multiple pregnancy, twins, triplets, quadruples, and all those areas you have to be like little more worried, where the nutrition will be shared among the fetus. And when the baby is having congenital anomaly, chromosomal anomalies in all these areas, also you can suspect small for gestation baby. Okay, so with this you are finishing the etiological factors which can cause low birth weight baby. And then when you come to the incidence part, it is going to be around 2 to 8% there are reporting cases with low birth weight. And when you come to the types, you have two types of low birth weight, one is symmetrical and one is asymmetrical. So symmetrical type of low birth weight is the low birth weight is present all over the body. So when the baby is formed, okay, in that period only, that is the total number of cells are going to be less. Okay, so that is less than the normal fetus. So when the total number of cells are very less, and when the pathological factors are intrinsic, that is the internal organs are going to be affected. So in that areas you will be saying the baby is having a symmetrical low birth weight baby. And then when you come to the asymmetrical low birth weight baby, it is the baby's total number of cell will be normal, that is like same like a normally born baby, but the function or the working condition will be less. Okay, and the pathological area is expressed outside, that is like it is extrinsic, so the organs are affected and which is shown outside. Okay, so with this your symmetrical and the asymmetrical differentiation of low birth weight is over. And then when we come to the care and management, so first care you are going to provide in the labor room, where when the baby is born. Okay, so the labor room must possess a trained adequate personnel. Okay, so you must have a trained obstetrician, there must be trained midwives to handle the scenario. And then we must do resuscitation, that is as soon as the baby is born, the baby is not like other newborn babies, like it will take time for the baby to adjust with the extrauterine life. So what happens, you need to provide resuscitation to the baby. So maybe for some babies resuscitation is sufficient, some babies they need to go in for an intubation, that also you have to provide in case if it is needed. Then you are constantly going to monitor the thermoregulation, that is like whether the baby is going in for hypothermia. So as soon as the baby is born, try to provide warmth for the baby, like try to cover the baby immediately with the towel, that will be sufficient, and immediately shift the baby to the preterm unit. So in preterm unit your exact care begins, like where you are going to assess the weight of the baby. So you are going to check the weight of the baby whether it is a low birth weight baby or not, and then record the APGAR score. APGAR scoring is nothing but the A for appearance, P for pulse, G for grimace, A for activity, and R for respiration. So APGAR scoring has to be done 5 minutes, 10 minutes and 30 minutes you have to be doing APGAR scoring, and that will be recorded to show the improvement of the newborn. Then probes, you have to be careful in assessing the respiratory rates and the temperature. So you will have probes to monitor the respiration and the temperature of the baby. So when you come to the congenital anomalies, you have to rule out whether the baby is having any congenital anomalies. Okay, so you do a fast quick physical examination to rule out whether there is a congenital anomaly or not. And then coming to administration of vitamin K injection, these small term babies, that is these low birth weight babies are having a high risk of bleeding. So what you have to do is like you have to administer vitamin K. You administer for all the babies, but again for low birth weight babies you have to be little more careful, and within half an hour you have to administer IM vitamin K injection. And we are coming to maintenance of record. You have to maintain a record where you will register the weight of the baby, daily weight monitoring, the intake output monitoring, the vital signs. Okay, so everything has to be assessed, the respiration, pulse rate, everything has to be assessed daily, and recording to be done to show the progress of the baby. And then record vital signs, that is like already we have said in the record maintenance, you have to maintain all these things. So, this is what you will be doing it in the preterm unit. And then the management of complications, like when the baby is there in the preterm unit, you can expect many complications with these type of baby. The first one is respiratory complication, where sometimes the baby can go in for asphyxias, aspirations, then breathing distress, and anything can happen. You have to be careful in monitoring these type of baby. And then we have hypothermia or hypothermia. Hypothermia, it is because you don't maintain adequate temperature. Hypothermia and burns when the baby is exposed to high level of warmth, that is like when you provide like extra warmth, at that time it must not cause any burns to the baby. Then intracranial hemorrhages. So, already we have discussed these type of babies, they are having more chances for bleeding. So, you can suspect intracranial hemorrhages also, you have to be careful. And then feeding problems. So, already we have said the baby is not adequately mature. So, the baby will be having difficulty in taking feeds. Okay. So, it cannot suck normally as the normal weight baby does. So, what happens, you have to go in for an EBM, that is expressed breast milk. So, you have to take these expressed breast milk and you have to put it in a katori or a spoon of palada, and then you have to feed the baby. Okay. So, this is the way you will be feeding a low birth weight baby. And then we have infections. These type of babies, already we have said, like the baby will be prone for infection as the immune system is not properly developed. What happens, the baby is having lot of chances to get infection. So, GI infections, respiratory infections are very common. So, what you have to do is, like you have to prevent the infection for the babies. Like, however, when the baby is in the hospital environment, see to that all the procedures are done in a sterile manner. And when the baby is taken up home, so everything has to be taught to the mother how like clean or sterile things have to be done. So, including the feeding of the baby. Then metabolic problems, you have to assess like the metabolic problems which is present, hyponatremia, hypokalemia and all those things. Like when there is an electrolyte imbalance, you have to correct. So, as the need of the baby, you have to collect the electrolyte imbalances. And then we have patent ductus arteriosus. So, this is a very common problem with low birth weight babies. As the baby is born only, sometimes the baby will be blue in color, blue babies. So, you can suspect PDA and you have to rule out for the management areas, you have to concentrate. And then bleeding, again I said, like not only are intracranial hemorrhages, the baby can even bleed from the umbilicus. So, you have to be very careful, so that you give a vitamin K injection. And then necrotizing enterocolitis, it is because like when the baby is having more chances of getting infection, you can suspect there will be an NE. So, what you have to do? So, you have to take care of the baby. So, that is with your management of complication. And then coming to daily record maintenance. So, you have to already I said like what all you have to concentrate on the factors, like which areas you have to concentrate to see the improvement of the baby daily. And then the criteria for discharge. So, when you discharge the baby, okay. So, when the baby is improving with the weight, so when the baby is putting on weight, or when the baby is sustaining weight, that is like if the baby is holding the same weight of 2.5 kg, at that time you can discharge the baby. So, when you are discharging, you have to give adequate explanation to the mothers how she has to take care of the baby, and then you discharge the baby. So, the advices on discharges. So, when you send the mother home, you have to tell the mother that she has to concentrate on the feeding part, as because the baby is not normal like other babies, like she has to give an EBM, like in case if the baby is not trained up. So, till that period. So, you have to teach the mother like the sterilization of the spoon and your glass and your paladas, like when they are getting EBM. Okay, so that feeding has to be concentrated. And the visitors, so complete restriction of visitors you have to promote, like already the baby is a small small baby, the baby is prone for infection, and when you allow visitors like coming and handling the baby, there is lot of chances to get infection, and once the baby starts with infection, again the weight of the baby comes down. So already the baby is having low birth weight, and now again you are causing decline in the weight, like it is not going to help in the improvement of the baby. So you have to restrict visitors very strictly. And then clothes, like when you are going to take care of the baby, you have to concentrate on the clothes, that is like always have the baby covered with clothes. You will be having cap and hand gloves and leg gloves and dresses like cotton smooth white dresses, like you have to provide the baby. In case of winter or cool environment, you are supposed to wrap the baby with thick blankets so that the baby stays warm and the thermoregulation is maintained. And then the medications, like medications I said, like your normal immunization, we are not talking about the other medication, where when the baby is going to get discharged, you will tell the mother accordingly to the demand, that is like in case if the baby needs an multivitamin supplement, calcium or your vitamin D supplement. So those things like your pediatrician may prescribe you, and where you can start and you can continue, as the baby is not normal as the other baby. So in case if the baby is having a normal weight, you need not worry about these supplements. As the baby is having a low birth weight, you are supposed to provide multivitamin supplements, calcium and vitamin D according to your pediatrician's request. So then coming to the immunization, you have to vaccinate the baby with BCG as soon as the baby is coming to 2.5 kgs. Okay, so when the baby is crossing 2.5 kg, the baby is qualified to get the BCG vaccination, and the further vaccination according to the correct age group. Okay, so you can continue with the accordingly to the age groups, you can continue with the immunization schedule. So this is what with your low birth weight baby, and where we have discussed about the etiological factors, the incidence, the types, the care in the labor room, preterm unit, the prevention of complication, the criteria for discharge, and the care in home. So everything, and particularly you have to encourage kangaroo mother care to the babies, like where this kangaroo mother care is recently evolving technique, where the mother provides warmth for the baby, so the baby will put on weight. Okay, so you know how kangaroo care is done. So I will put you an video regarding this kangaroo care, how you have to provide and all those things. So but just for an outline, I will tell you, you put the baby in the chest and cover the baby nicely so that the warmth of the mother or the father, so anybody can give this kangaroo care. So the father or the mother provides adequate warmth for the baby. Once the baby is having adequate warmth, the baby will put on weight. Okay, so you have to understand the importance of kangaroo care, and then you have to teach the mother also, like which can improve the weight of the baby. So in the next class, we will see some other disease condition. Hope you understood the class. In case if you want have any new topics, kindly go and give your comments in the comment box. Take care. Bye.